But what happens is viruses like to hijack the cell, and they hijack the nucleus, and they hijack our mitochondria. And that causes a disruption of how our mitochondria works. Mitochondria is what makes our cell do what it does. It's what makes energy production. So it's what makes our brain cells work, our heart cells work, our muscle cells, every cell throughout our body. So if you disrupt the mitochondria, you're going to have all kinds of myriad of symptoms. So you're going to have the brain fog. You're going to have the muscle fatigue. You're going to have mental fatigue. This is going to affect how your brain works. This can lead to anxiety, depression.
You're watching the Dr. Jake podcast. Hi, everyone. Welcome back. I am Teresa. I am a mom, a health nut, a wife to a cancer fighter, and I'm here with Dr. Jake to talk about the common long-haul COVID symptoms that he's currently seeing in his office and how he's helping these people manage and heal from the struggles that they're facing from long-haul COVID. Dr. Jake?
So this is something I've been eager to talk about because I've been seeing more and more of this, and it's going to be an exciting topic to talk about.
Definitely. I'm hearing a lot more of it as well. I've got friends who are complaining about hair loss. I've got other people that are talking about, like just how tired that they've never really gotten their energy back. And so it's going to be really, I think, exciting for me to be able to listen and to talk with you about this so that I can, share the hope that I think that you are providing your patients as you're helping them. But before we get started on jumping into this really powerful topic that I think is going to really help so many people, we do want to first remind our audience watching that this is just a podcast, right, Dr. Jake?
Yeah, so this is only a podcast. So if someone you know or you have autoimmune disease, cancer, or any other chronic illness, reach out to our website, integrativemedica.com, find our phone number there, and you can set up a virtual or in-person visit with me or many of my other doctors that we have at the clinic.
Awesome. We love your clinic so much. It's just been such a life changer for my husband and I. So eager to see what you're seeing right now. So I know, you obviously are a naturopath medical doctor. More and more people are starting to wake up to the benefits of seeing a doctor that has such a wide breadth of knowledge in so many different areas of how to treat people, which is, I think, why your practice is just growing and so many people are coming in. Right now, we're what, like 2 years into this pandemic, and we're starting to see more and more, because so many more people have caught it, more and more examples of people having this long haul COVID. Can you first, before we even jump into these symptoms that you're seeing, can you help any of our new audience members who may not be familiar with the term know, like, what is long haul COVID mean anyway?
So there's long haul COVID, also known as post-COVID syndrome among the medical community. So this is you get exposed to a COVID variant. You could be exposed to alpha, beta, Delta, Omicron, whatever, all kinds of different variants. And I'm seeing all these variants causing long haul COVID. What it is, you get exposed to it, you get over the acute symptoms, but then you're having these long-term symptoms that are lasting over 2 months long. So, and there's various symptoms that go along with this. You just don't tend to be getting over it. Or maybe you got over it and then you start noticing certain things a couple months later. So these are all related in the category of long haul COVID.
I know for my husband, we got COVID in or Thanksgiving of 2020. He immediately got pneumonia from it. Now, my husband, as I've mentioned earlier in this episode, is a cancer fighter. So, obviously he has some comorbidities, which, made us nervous about him having it. So it's no surprise to me that he got pneumonia from it. But, he got through it. It took him, I think the standard 14, days that it took him to get through the COVID. He was on, medications and so forth to help him with the pneumonia symptoms, and everything was fine. And then, like, right around Christmas Eve, so we're looking like at a month later, right? Probably 2 weeks after his symptoms had completely gone away, he was starting to get really bad chest pains, to the point where we were thinking, like, we got to the point where it was like middle of the night, like we should probably go to the ER, like there's something wrong. And when we went to the ER, they thought he was having a heart attack. He had some proteins that were showing up in his blood that showed heart attack. So we thought he was having a heart attack. He was sent over to the University of Utah and their intensive care. And what they ended up finding out after a number of tests is that he had developed pericarditis from the COVID. And so it took some time. I mean, he had to be on a number of medications for a few months to heal his heart. It was, I think, pericarditis is like, I don't know, like a swelling of the heart, like a type of
Mhm.
infection of some sort. That was kind of his experience with post COVID syndrome. But after that, he's been fine. There's been nothing that's happened since then that's been long term. I'm really thankful that we had doctors to help us through that. As far as what you're seeing, are you seeing things like heart issues? What kind of symptoms are you seeing showing up in the patients that are coming to your office?
I am seeing people with heart issues, so that's a less common type of area. I'm seeing pericarditis, myocarditis, flutters, atrial fibrillation, things like that. So arrhythmias are definitely happening. Clot disorders are I'm seeing happening. Increased risks of heart attacks and things like that. That is definitely happening. This is more in the rare realm. What I am
Mhm.
seeing a lot of is chronic fatigue syndrome. So
Mm,
people that are just not getting their energy back. So they're
mhm,
feeling tired all the time. They're not able to function very well. The brain fog is extremely common too. They're not able to remember things as well. They kind of feel like they're kind of up in the air. They're not quite all the way here. I'm seeing people that have already been dealing with anxiety, depression, it starts getting worse, or people that never really dealt with this, it starts anxiety, depression starts showing up, or they start having sleep disorders. I'm seeing people that their muscles just feel weak, so they have difficulty, like more difficulty working out. So they're not able to, they don't have as much endurance or as much strength. I'm seeing people that are starting to get headaches. And big thing I'm seeing is I treat a lot of chronically ill people is I'm seeing an exacerbation of their conditions. So we have it all under control. They got COVID, and then their symptoms could get worse. Maybe their autoimmune condition gets a little worse. So let's say they have rheumatoid arthritis, their joints start hurting again. Or if they have multiple sclerosis, they start having some of the neurological symptoms, the numbness and tingling start getting back. And then we have to do a lot of treatment to try to get that under control again. So it tends to be increasing that inflammatory response in the body and exacerbating people's conditions. And I'm also seeing like I have a lot of chronic illness can be related to chronic infections. So besides just COVID, you could have a chronic infection lingering around like Epstein-Barr virus or Mycoplasma pneumonia, cytomegalovirus, whatever, Lyme disease, and that condition can reactivate itself
yeah.
and make all this inflammatory issues happen throughout the body again too.
And that makes sense because I know that those types of viruses are activated by stress.
Yeah.
And if you're dealing with all of this post-COVID symptoms, it's going to stress your body out, and it's going to wake
Mhm.
up these dormant viruses. So, man, that could cause a whole slew of issues, I can imagine. Now, are you noticing a difference? Those who are coming in with these post-COVID or long haul COVID type of symptoms that you're working with, are you noticing a difference between your vaccinated patients or your unvaccinated patients with like who's having these issues?
So I'm seeing both the vaccinated and unvaccinated having long haul COVID. So since you've
Mm,
been vaccinated, it's not necessarily keeping you from getting long haul COVID. I am also seeing that people have severe long haul COVID. They don't necessarily have long haul symptoms. And I'm seeing people that have very mild symptoms and then they get long haul COVID. So it doesn't go along there. Everyone's getting it. I'm also seeing patients that are presenting with issues from just the vaccination too. So, and similar type of symptoms, and maybe a little bit symptoms that are even more difficult because it's really because we don't know how much of that spike protein keeps on getting made once you're vaccinated, and that's causing all the symptoms that we talked about long haul COVID. I've seen people that haven't been exposed to COVID experience those symptoms after getting vaccinated. So it's happening both in the vaccinated and unvaccinated.
So why is this then happening? Like, do you have an explanation as to what's happening in the body after COVID that would lead to fatigue and depression and hair loss and heart palpitations and muscle fatigue? What's going on in the body? Now you mentioned something about spike protein, and I know that's I've never even heard of spike proteins until this pandemic. And I know many people who are watching might be like me, kind of wanting to better understand what role that might play in this. Please enlighten us. What is going on?
So we could dive into the spike protein to start here. So the spike protein is this protein on the outside of the virus, and there's all kinds of different proteins on the outside of the virus. And when you get exposed to COVID, you make an immunological response to all these type of proteins, not just to the spike protein. And let's say you get the vaccination, you're making an immune response, antibody response to just that specific spike protein. But what we're finding out is it's the spike protein is one of the more cytotoxic or inflammatory components of that virus because it can implant itself in your blood vessel and cause inflammation of your blood vessels, which then decreases blood flow circulation, but then it can increase your risk of getting a blood clot. So, and that can lead to people getting the myocarditis, the pericarditis, the strokes, the heart attacks, these type of things that are happening. Just from that decreased blood flow can be leading to the muscle fatigue and the chronic fatigue because of the decreased circulation of blood flow, the decreased oxygen delivery throughout the body. So that's a big piece there also. And big thing I want to talk about is there's mitochondrial trauma that happens. And I hope more physicians start waking up to this mitochondrial trauma because of COVID. That might be one of the great things that come out of this. It's something I've been treating for a long time related to other viruses or other bacteria can cause this mitochondrial trauma. And COVID is doing the same thing for people. And I think people are more in tune because of
Mm.
the popularity of COVID that when they're getting COVID, they're feeling really sick afterwards, and they actually are relating it to COVID because before they might get the flu, they might get Epstein-Barr virus, they got over it, and then they just haven't gotten better. They're like, no way, it's really related to this infection that I got. It's not related to that at all. But what happens is viruses like to hijack the cell, and they hijack the nucleus, and they hijack the mitochondria, and that causes a disruption of how our mitochondria works. Mitochondria is what makes our cell do what it does. It's what makes energy production. So it's what makes our brain cells work, our heart cells work, our muscle cells, every cell throughout our body. So if you disrupt the mitochondria, you're going to have all kinds of myriad of symptoms. So you're going
Mm.
to have the brain fog. You're going to have the muscle fatigue. You're going to have mental fatigue. This is going to affect how your brain works. This can lead to anxiety, depression. So there's all kinds of things that can have chronic pain, like chronic pain throughout the body is related to mitochondrial disruption. Chronic headaches, all kinds of things are related to this mitochondrial disruption. You might start getting gut issues. That's a common symptom that we're seeing happening in
Mm.
patients too. They start getting maybe chronic diarrhea, chronic constipation since getting COVID, and that's from disruption of the mitochondria. And also going to my next point is it causes this chronic inflammatory response. It wakes up your immune system and makes it too overstimulated. So that can cause inflammation in the brain, and that leads to what we like to call leakiness of the brain or the blood-brain barrier. So the
Mm.
blood-brain barrier is supposed to keep all this stuff out. It's a very important thing that we have. Sometimes I don't like it because I can't get some of my goodies into the brain, and you have to do some things to help do that. But it's very good because it keeps all the toxins out of our brain too. So let's say we make that brain more leaky. Okay, substances are there to get in there, but toxins are able to get in there, and we're always exposed to toxins. So it's going to get more readily into the brain and cause inflammation of the brain, which is then going to disrupt the neurotransmitter makeup in the brain, and that can lead to anxiety, depression, insomnia,
Yeah.
brain fog, etc. So there's that inflammatory component in the brain, and also the mitochondrial disruption that's leading to all these psychological stuff or the poor memory or feeling like you're kind of out up in the cloud type of sensation. And this spike protein specifically will cause this chronic inflammatory response. So, like, let's say that's one of my concerns. Okay, you're going to be okay if you get vaccinated with COVID-19, but what most of these vaccines do is stimulating your body, making your cells inside your body make more of this spike protein, the specific cytotoxic spike protein. And in the beginning, they're saying, "Oh, it's completely different." No, it's very similar, and it's very similar symptoms. They're saying, "Oh, it's going to just be localized in the injection site, and that's going to be good." No, we started seeing that circulating throughout the entire body. We started finding it in all organs. We started earlier finding it in the brain and the ovaries and our adrenal glands and things like that, and then we started noticing it all over the body. So there's that spike protein component, and I think that's why I'm seeing when people get vaccinated, they're having all these. I don't call them necessarily long haul COVID, but they're very similar because they're getting that spike protein and disrupting their mitochondrial function, causing this chronic inflammatory response throughout the body with that. A big thing, like we talked about, there's a reactivation of the bugs. So a lot of chronic illness can be related to chronic bugs. I always look to see if they do have Epstein-Barr virus, cytomegalovirus, mycoplasma, Lyme disease, or various other bugs. There's thousands of other bugs out there. I look at some of the basic ones and I see that people have a lot of different bugs. I'm saying, yeah, They probably have all kinds of ones that we haven't tested, and we need to treat it broad spectrum type of treatments for that. But when that gets over, when you exacerbate those chronic infections hanging out, that's going to make your immune system go crazy too and lead to all these type of symptoms. So that's the big things that are happening in a nutshell. Activation of the bugs, the damage from the spike protein, the chronic inflammatory response, and the mitochondrial disruption are the big reasons why people are experiencing these long haul COVID symptoms.
Now, are these explanations also reasons for the hair loss? Is it that your body just doesn't, the mitochondria doesn't have the energy to make more hair?
Yes, it is. So a big
Okay.
piece of what I'm doing to treat post-COVID hair loss is treating the mitochondria. And we do that for all kinds of other hair loss too, is treating that mitochondria. But yeah, there's disruption of the mitochondria, but also there's accumulation of the spike protein of the virus. The virus goes and hangs out there and causes disruption of the hair follicle, inflames the hair follicle, and then usually people are starting noticing a month, maybe 3 to 4 months after even having COVID. So they get over it, and then they just start losing this hair randomly. Like, what the heck is going on here?
Right. Well, that makes sense to me because I think like the common wives' tale is that we lose 100 hairs a day. And so, but you lose 100 hairs a day and then 100 hairs come back in to replace those 100 hairs.
Yeah.
But I imagine, 2, 3 months of losing 100 hairs a day and no hair is coming back in, that you're gonna start noticing it in a month or 2, like, "What's going on around here?"
Where's that piece
Um,
too? And it's making your hair fall out a lot more than 100 hairs.
wow.
So
That
you're
makes
losing tons of hair. I mean, some
right,
people are losing handfuls of hair when they wash their hair, or they just put their hands through the hair. And they're like, "What is this? Big patches of hair coming out." I mean, these are the people having it more severe,
right.
and this is something I'm dealing with too. I'm currently having post-COVID hair loss. It's slowed down. I've been hitting it hard, very hard. It's a very hard thing. I've talked to a lot of my colleagues throughout the country that are dealing with this, and it's a very difficult hair loss. It doesn't respond to normal hair loss treatments that we do. So we have to look at it in a different way, and we need to be really aggressive about treating it.
Interesting. Well, I'm eager to hear some of the things that you're doing to help your patients with their mitochondrial issues and viral issues that they're fighting because of the post COVID. Before we jump into that, I want to ask a couple of questions. First of all, for those of us who are watching who might are maybe currently have COVID at the moment or haven't yet and like, oh, it's going to be a matter of time, like, do they need to worry about this? Is this common, these post-COVID symptoms?
So it's not extremely common. There's a very minute group that is having this. Now, it is quite common for people to feel fatigued for about a month, for a month up to 6 weeks after getting
Okay.
COVID. That's not that uncommon, and that's okay and normal. They might have a little brain fog for a month too. So that
Okay.
is common, and that could happen. But long haul COVID is usually it's over about 2 or 3 months, and it's maybe going even longer if you're not really getting treatment for it. It's very rare. I see it in my patients. I'm seeing the hair loss more than I would even think of that. I mean, but again, a lot more people are getting it now because we have a lot more contagious variants that aren't as
Mhm.
severe, but they tend to still have some of these long haul COVID symptoms, especially the hair loss. I'm seeing way
Right.
too much of that right now, but I wouldn't be too concerned about it. I want to put that out there. It is a very small group. I know tons of my patients. I've treated over 100 patients with COVID, and there's a small, minute group of people that have actually had long COVID. So if you have COVID right now, don't be like, "Oh man, I'm in for it because I'm going to start losing my hair and I'm going to start getting brain fog. I'm going to be tired and I'm going to have all these autoimmune conditions start showing up." Again, this is only a small group, and I'm speaking to that group of people that are dealing with this long haul COVID because it is real. And I think some of them are being dismissed. I think what's great about COVID and maybe the waking up of other doctors in the medical community is people are actually thinking, yeah, I think maybe what you're dealing with is actually related to a virus. Because
Right.
before they would just be dismissed and be like, "You're a crazy person. No
Yep.
way this is caused by some bug, or you're all the symptoms that you're experiencing are all in your head."
Yep.
Hopefully, this will wake up doctors and they'll be able to see what's going on and see this long haul COVID. But it is real; it does happen, and it's likely related to COVID if you start noticing these things within a couple months of having COVID. And we definitely have good options to help you deal with these.
I am in a complete agreement with you. I'm also, being a wife to a cancer fighter, we've had to, learn a lot about mitochondria as well because of, treating the cancer metabolically. And, I learned about mitochondria in high school biology, but, never gave it a second thought after that. It's like, that's what it's like, I identified it in the pictures of the cell. That's the mitochondria. Okay. TP energy, whatever. Like, it was just enough to pass the test and not really a knowledge of really understanding, like, how does this play a role in my body? And so, what I'm really excited about is seeing how more people can start thinking about, like, I don't think we've given a second thought about our mitochondria, and I think as you're really talking about, like, that's an important part to be taken care of because it is the root cause of so many health issues. And for the first time, maybe we're going to finally start thinking about it, and even whether we have COVID or not, long haul or not, like, really thinking, how can I better take care of my body and address and either prevent health issues or actually truly heal at the root cause. So, jumping into that, what are some of the things that you're doing to help your patients with their mitochondrial issues or with their viral issues that have woken up? What are some common things that you're practicing in your office?
So there's a lot of different things and a lot of different components that we have to dive into because COVID's causing all these different things throughout the body. It's not just necessarily mitochondria, it's not just brain, it's not just inflammation. There's all kinds of things going on, so we need to approach it that way. But the big thing that I'm going after and treating is the mitochondria. That's the biggest one. Number one, we need to go after. If you did, if that's the only thing you did, that's the most important one. And my favorite products to take to help boost our mitochondrial function is acetyl arcarnitine. So why am I saying acetyl arcarnitine? There is just regular carnitine.
Hmm.
Acetyl arcarnitine, when you take it oral, is going to absorb much more readily. So it's a more absorbable form. And we take that to shuttle the fatty acids from our body into our mitochondria to get it working and get all the processes churning again. So carnitine, it works really well with that.
Hmm.
I like to use alpha lipoic acid. This is one of our major antioxidants throughout our body. It's great for doing all kinds of things throughout our body, great for the nervous system, great for our liver, great for cellular detox, etc. But it's really great on healing the damage and then that has happened to the mitochondria itself. We also have CoQ10.
Hmm.
CoQ10 is the one of the last steps of our cycle that goes. We go through several different cycles when we're making energy and going through the mitochondrial process. We need CoQ10 at the end to help make ATP production. So when we get that, we're helping support that mitochondria to increase that energy and ATP production in the body. And then my favorite thing, which isn't just focused on mitochondria, even though all these things aren't focused on that, but glutathione in a roundabout way will help support the mitochondrial effect. So when you're taking oral glutathione, my favorite way is more of a liposomal glutathione because it's not very well absorbed. So you want to get it liposomal. This helps it get absorbed in the stomach and goes through these things called your lacteals, which is where your fat gets absorbed. So it doesn't have as much time going through the stomach and then the small intestine and going through all these digestive juices, which are just going to break it down
Break it down.
into its
Mhm.
individual amino acids, which might be made into glutathione, but then it could be made in all kinds of things throughout your body. So we want to do that way. And then my favorite way of all, if I'm treating someone that's dealing with bad long haul COVID, it's IV glutathione. That's the
Got
way
it.
we're going to get really high doses of it, and it's going to get that effect that we really want. That's where I'm seeing the big effects. Usually, if I'm treating someone that's been dealing with long haul COVID for over 2 or 3 months, IV glutathione is the best one I see. Even though oral glutathione does help, and I have seen great effects with that. People that aren't able to do IVs, that aren't close to me or can't afford doing the IV procedures
Mhm.
or whatever, you can do it. But if you can, the IV glutathione is going to be more potent on getting that mitochondria working. It's also going to decrease the inflammatory processes throughout the body. It's going to decrease the oxidative stress that's happening throughout the body. It's going to help clear out some of these spike proteins and viruses that are hanging out in our body, cleaning out. So that's a really great therapy I like to do. So let's go dive into the brain area. So the leaky blood-brain barrier. So
Hmm.
how we treat a leaky brain-brain barrier is quite similar than we treat a leaky gut. So we want to be using glutamine is one big one, zinc, carnitine, and acetylglucosamine. These amino acids are going to help heal that blood-brain barrier and get it to stop being leaky again. Also, a big thing is we need to decrease the inflammation in the brain to help with this leaky gut blood-brain barrier. So what we want to do is high doses of turmeric. Usually I like to get it in an absorbable form that's going to go through the gut very well. So you want to bind it to some fatty acids, maybe some black pepper. Things like that will help
Okay.
get that turmeric more readily into your bloodstream because we want to get it into the brain and decrease that inflammatory process. We also have fish oil. We want to make sure we get a high quality fish oil with a high amount of EPA, DHEA. Usually I like it to have about 900 EPA, 700 DHEA. So you want to make sure it's a good potent fish oil that you're getting. Make sure it doesn't have mercury in it and things like that too.
Wow.
That's very important. Also, I really like resveratrol. So that's
Mm.
very good on decreasing the oxidative stress, but also decreasing the inflammation in the brain. And then it's going to decrease inflammation throughout your body, just like all these things are going to do. It's not just going to focus just on your brain. It's going to decrease inflammation throughout your entire body. And then when we need to get a little bit more aggressive is I check, let's say it's a woman that has all this brain fog. I'm going to check her progesterone, make sure her
Mm.
progesterone's in a good level. But let's say it's not, I'm definitely going to be giving her progesterone, bioidentical progesterone to help calm this thing down. Now, let's say they have normal. So sometimes I need to be giving them progesterone, even if it's normal, because it's one of our best, what's called neurosteroids. So that's, I know some people hear that word steroid, they start to screech a little bit. But we
You
have
actually
natural
need it.
steroids throughout our body. So cortisol and progesterone are some of our best steroids that we have. This is specifically called the neurosteroid because it decreases inflammation in our brain. So it's a
Mm.
very potent anti-inflammatory in our brain. So I give that sometimes. And for guys, I don't give progesterone. I give pregnenolone, which is a prior step. So you go through several different processes to make progesterone. Pregnenolone is just a step right before progesterone, and it works really great for guys. It does work good for women too, but progesterone's a little bit more potent, and I don't want to give guys progesterone, and that might mess up with their how their body works appropriately. So that's what we do for the inflamed brain. Also, what I love for the inflamed brain, and really we're going to go talk about the circulatory effects too, is hyperbaric oxygen.
Mm.
So why do I want to do that? So what happens is one of the strongest therapies we got to decrease that inflammatory process is hyperbaric oxygen. It's going to decrease that inflammatory process. But when your brain gets inflamed, the blood vessels get inflamed, and more specifically, the capillaries get inflamed. And capillaries are little microscopic things. You're only going to see them under a microscope. They're microscopic like a red blood cell. They're actually so small, the red blood cell has to clap half its size to be able to get the red blood cell into the area that it needs to be. But when it gets inflamed, the red blood cells aren't able to get in there as well. So you're not getting great oxygen delivery to your brain or throughout your
Mhm.
entire body. So the muscle fatigue, the fatigue, etc. So you're not going to get that oxygen delivery. So hyperbaric oxygen puts oxygen right into the plasma of your blood. So it doesn't matter how narrow that capillary is, fluid is going to get in there, deliver that oxygen right into there, and start getting that mitochondria in the brain working again. So you might be taking all these great things to stimulate mitochondrial function, but then you're lacking the oxygen, you're not going to get everything going there. And hyperbarics by itself, the pressurization that happens, it decreases that inflammatory process happening in the brain. Also, this is going to increase circulation throughout your entire body, get the oxygen and blood flow going throughout your entire body. So this is going to help with the chronic fatigue, the chronic pain,
Mhm.
the muscle fatigue, all these type of things improve with hyperbaric oxygen. One other thing I'm really liking for healing up the brain too is I do photobiomodulation therapy, which is a technique we use laser light intracranially. So we put this specialized helmet on your head and we do red light and infrared. And that light is able to actually penetrate deep enough into your brain. It goes 4 centimeters deep. So it goes through your skull, goes in there, and that helps decrease that inflammation and starts the regeneration and healing process. It was very interesting when I did this on my wife when she had COVID and she started getting a little brain fog and stuff about a week in from having COVID. And I just was like, okay, we're going to use this cap on you. I think this is going to clear it. Every time she used the cap, the brain fog was gone the next day. And when she didn't
Wow.
use it, she didn't have brain fog. So so I was able to see night and day type of things when we were doing this. When usually when I'm treating really sick chronic people, you don't see the night and day thing, but you can see it when someone just had COVID, they were
Generally
healthy,
healthy.
and then they
Yeah.
had that inflammatory process happen, and then this was able to decrease that.
I'm imagining her with this metal thing on her head going.
It's not metal. It does make you look a little bit like you're in Star Wars, though. It's
Yeah.
like a Star Wars help
The
stormtrooper type of
I was
look.
thinking like the foil, maybe like the foil caps or something like that. But but recognizing and seeing, wow, I do feel better. And
Mm,
some of this stuff, I think for some people might be like, what are you talking about? I've never even heard of it, because we don't see what you're talking about in mainstream
yeah.
medicine.
Hmm.
But there's just so many amazing tools that we have out here to be able to help us. So I just love hearing a lot of this. Now, I'm sure you have more to share, and I want to get to it, but I have a couple questions. I want to pause for a couple of these things. For this hyperbaric oxygen, for these types of like infrared lights and red lights and things like that, this is obviously things that, like, some of these things are like supplements that you can pick up right on your own. But then some of these are not something that you can just have on hand.
Yeah.
I imagine that the dosages for these supplements that you're bringing up are going to vary from patient to
Sure.
patient to patient. And then I also imagine, how often you prescribe, like, okay, you need hyperbaric oxygen, all the symptoms that they're having, what you're finding was going on with their hormones. Like, it's not a cookie cutter approach to each person.
Definitely. It's not.
Okay. All right. So I do have a couple of questions before learning about some of these other treatments that you're doing, just to kind of get some clarification. First, a lot of these supplements that you bring up, I've got two questions really about it. One, supplements tend to come from food. Is there a reason why we need to supplement with these versus just getting it through our food alone?
Yeah, so big reason is we need higher doses and we need specifics of these things that we're doing. And when we look at the literature, we have these specific dosages that we want. So when you're not really dealing with a severe chronic illness or anything like that, you could definitely get all these things from food. You could be a very healthy person without having to take supplements. But when you're not a healthy person, we need to be more aggressive and we need to get higher doses of certain things and be more specific on what we're doing. So let's dive in maybe some basic dosages. Acetyl carnitine 600 milligrams twice daily. You might need more. You might need less. That's why you probably should go to a doctor that knows what they're talking about. Alpha lipoic acid, maybe 200 to 600 milligrams, depending on the size you are or what we're dealing with. Glutathione, 200 to 400 milligrams daily of glutathione, depending on what we're dealing with. Resverotrol could be 1 to 200 milligrams, maybe even higher. So yeah, these are just some quick dosages that we have here. But again, this is going to vary person to person. And people that aren't dealing with a lot of severe things aren't going to have to do some of these procedural things that we talked about, the hyperbarics, the photobiomodulation therapy, the IV glutathione. If they're just dealing with mild post-COVID symptoms, healing up your mitochondria and taking care of this inflammatory component is going to clear it. I see it
Right.
all the time. But I have a lot of patients that don't clear with just this, and we need to be more aggressive and do the IV procedures, the hyperbarics, and the photodynamic therapy to help them.
And that makes sense. So it seems like it's not a cookie cutter approach with this. This is, that's why this is a podcast. It's here to really, give you an overall education on it. But to get anything specific for your particular post-COVID symptoms and what you're going through, getting the details of whether or not you need the hyperbaric oxygen, whether or not you need the red light therapy, what your dosage is looking at. That's where experts, naturopathic medical doctors like Dr. Jake really come in. Fascinating. Now, is there anything else that you're doing with some of these types of symptoms that you're seeing?
So let's talk about the hair loss one. So a lot of these things I already talked about is we need to work on the mitochondria. We need to work on the inflammatory component. There's so much that needs to be done. Like I said, post-COVID hair loss is different than other hair loss. I'm also doing the red light therapy on the hair follicles. So
Okay.
the helmet that I use does go into the brain, but it treats the hair follicles and helps regenerate and heal those hair follicles. Some people that have lost a lot of hair, I am doing therapies to help stimulate regeneration and healing of the hair again, so it actually comes back. So we're doing PRP of the scalp. So that's platelet-rich plasma. We
Mm.
draw some of your blood out, we put it in a specialized centrifuge, and we inject that along the scalp throughout the entire scalp to stimulate and regenerate it. So PRP is high in growth factors and a little bit of stem cells to stimulate that regeneration of the hair follicle. And we do a combination of that with the red light therapy. Can work really well getting your hair nice and thick and robust again when we're doing that. So those are some of the things we're doing there on top of all the other things that we did talk about. Like I am even doing hyperbaric oxygen IV nutrient for glutathione because some people's hair just isn't falling out doing the basic stuff and we need to really hit it aggressively. And I'm doing that for myself. So my hair, I was like driving me nuts. It wouldn't stop falling out. And I started having to be more aggressive, doing hyperbarics, Nutrient glutathione, the red light therapy, taking all the supplements that we talked about. And it's finally starting to slow down. So yeah, it can be hard in some people to get this hair to stop falling
How
out.
long, did it take before you started seeing results on your head, from the treatments that you're giving yourself?
Yeah, 3 to 4 weeks.
Okay.
So
Like,
you
that's
definitely, with hair, you need to be patient. Like with the brain fog, I see that clear within a week.
yeah.
It's pretty quick. Even the fatigue could clear within a couple weeks, 2, 3 weeks, depending on how severe it is. But the hair loss, there's a process that's already started in your brain, in your hair follicle. It's already been damaged. It's already inflamed. So what we're doing is trying to stop that inflamed damage that's already happened. And when the hair follicle gets damaged, you start losing your hair. So
Mhm.
it's that process that's already started. So it takes time, and you need to be really patient with hair. I always tell my patient, when your hair starts falling out, you're not going to usually notice things immediately. It's going to maybe take a month or two for
Right.
things to start kicking in, but then it will kick in. So I know doctors telling me that they have some patients that have been losing hair for a year. Most people don't do that. Sometimes it's 6 months. So you definitely want to try to, don't think that it's just going to go away, because sometimes it won't, and you need to maybe do something about it. Do some of these supplements that we're talking about that usually clears it. Do a shampoo that might decrease that inflammation there. I'm using like a Dr. Christopher's BFG shampoo. I really like
Okay.
that. What's great about it is, we need to think of this too, is we talked about reactivations of bugs, and I'm going to
Mhm.
dive into treatment for that in just a bit. But what's happened with some of these post-COVID patients is they get a reactivation of an infection on their scalp. They may have never known they had this
Hmm.
infection just hanging out on their scalp, but then the reactivation of that infection hanging out on the scalp can cause inflammation of the hair follicles and start falling out like crazy. So we need to treat that infection on the scalp too. So we need to do something anti-inflammatory, but also kill the bugs shampoo wise. So this shampoo that I was talking about has several different herbs in there that kill off bugs, but also decreases inflammation. And I really like that, and I think that's been a big component of my decreasing my hair loss too. Is
Can
just this
Where can we
Dr.
find this
Christopher's
shampoo?
BFG. Just search it online. That's where I got it.
Okay.
They might have it on Amazon or just random places. Dr. Christopher's BFG shampoo, I think it's called. I think it could be a great option for some people. So
That's
let's dive into these chronic infections that reactivate. So this is a
yeah.
big topic. I just want to start with a story of one of my neighbors. It's an interesting story because I just kind of sat back and laughed a little bit when she was telling me the story. The reason is, and this is more of a vaccination story than a COVID story, but this is goes along the same realms. When you get the COVID-19 vaccination, this can reactivate bugs also. So
Right.
what happened is she got the vaccination. She was fatigued for a month, and she was so tired, she couldn't get out of bed for a while. The doctors were trying to find out what's going on. And then they eventually started looking in, okay, maybe she has mono. So let's order Epstein-Barr virus antibodies. And guess what? It showed that she had Epstein-Barr virus. So they're like, oh, you had mono. And middle 30s woman is very unlikely going to get exposed to mono the first time
Yep.
when she's mid 30s.
Right.
What happened is she had mono Epstein-Barr virus hanging out in her body, and then it reactivated when it
Mhm.
got exposed to that spike protein, which we're seeing from people getting vaccinated or people that are getting the live virus. We're seeing that reactivation. So that was just an interesting story because I heard her telling this story, and I'm like, no, that's not really what happened. You didn't get mono. You got a reactivation of Epstein-Barr virus, which was hanging out in your body, which was caused by the vaccination. I didn't really dive into that because probably didn't want to hear that, but that's really what happened. And most doctors really don't understand this reactivation of bugs. They really don't look into this very much, and they don't get the research onto this area. But what can happen when you get exposed to COVID is you get reactivation of virus, cytomegalovirus, mycoplasma pneumoniae, Lyme disease, chronic strep, or varied of other bugs that are out there. So, and that could cause a total disruption, make your immune system go crazy. So people could get these weird rashes. This is happening with people exposed to COVID, people that are getting the vaccination. They get these weird rashes that they never had rashes before, and whatever they eat, they start getting this rash. Or when they're
Mm.
exposed to any type of chemical, they start getting really bad rashes. The reason why is your immune system's way overstimulated, and a big piece of that is probably chronic infections are being reactivated, making your whole immune system go crazy, making your mast cells dump histamine, So we need to focus on going after these chronic bugs. So we do antimicrobials to help go after this. We do antiviral treatments, antibacterial treatments, antiparasitic, antifungal treatments. Depending on what bugs we think that are going on in their body, we treat that.
And you're
So
able to take blood tests to figure
yeah,
out what bugs are
so
happening?
that's what we do. You come into the office and we order based on what I think is going on. We order blood tests and we look for a myriad of these viruses or bacteria or parasites, etc.
Parasites. Interesting. So then now you're dealing with, killing the bugs. And then on top of that, also managing the other symptoms that have come from,
Yep.
the energy loss and so forth. Powerful. Okay. So for our listeners who are listening to today, and maybe they're going, oh my gosh, this is exactly what I need. I'm totally experiencing hair loss. I've got this fatigue that I haven't been able to kick. It's been 6 months. How can they get a hold of you so that they can find out what exactly they need to do for their particular issues
Yeah,
and heal?
so you can visit our website, integrativemedica.com, find our phone number there, give my receptionist a call, and you can set up a virtual or in-person visit with me or some of my other great doctors we have at the office.
Wonderful. Well, thank you so much, Dr. Jake, for all of your expertise. I'm hoping that this is giving a lot of hope to people who are dealing with some of these symptoms. I know that we have some other episodes where we have talked a bit about some of the topics that we brought up today, vaccination versus unvaccination, and what that does. What the difference is on your body. We have some episodes where we've discussed glutathione to great depths on what it does for the body, and I know that Dr. Jake mentioned that today as part of his treatment for long haul COVID. So, make sure and check out the next video that pops up here on your right hand side if you want to have or watch more and learn more from Dr. Jake on how to get healthy naturally. Thanks so much, everybody. We'll see you next week.
Hey, Dr. Jake, thank you for your time today. And if you enjoyed the show, then do us a favor and leave a review. It helps more people to find the show, which could save their life. And remember, this is a podcast and should not replace personalized attention from a medical professional like Dr. Jake. If you or someone you know has been diagnosed with an autoimmune disorder, cancer of any stage, or a life-changing illness, visit our website today and schedule a virtual appointment with one of our doctors who can lead you to a treatment plan in your area. That's integrativemedica.com. Integrative, Medica.com.
Thank you for listening to the Integrative Medica podcast with Dr. Jake. To hear past episodes and get alerts for the future, subscribe to us on your favorite podcasting platform and be sure to follow us on YouTube as well. Just search for Integrative Medica with Dr. Jake.